As Saujanya mentioned, that it is one of the most important topics, and I personally, as an occupational therapist or a sensory integration therapist, lay a lot of emphasis on this particular thing. The reason behind that is many of our children who are either on spectrum or who are having concerns with sensory processing, they really don't understand the importance of proprioception and vestibular sense, uh, and how to address it during the early stages. And why I'm taking this topic, the long-term effects of proprioception and vestibular sense during the adolescent or adult phases, not to really make you worry about it, or not to really I'm just giving you a heads up how you're going to proceed if you really where you can see your child if you really don't address it in time. That is the only intent of taking this long-term effects of proprioceptive processing. So what, as I said, it is important because all of you know that we have this basic five senses, and they say that the most important, the sixth sense, other words, is proprioceptive and vestibular sense, right? Sixth and seventh they call, but the sixth sense usually we say it, that is proprioception. And why proprioception is important, and why proprioception and vestibular sense are important? They are important because a human being can survive even if he is visually impaired, or if there is hearing impairment, or even if he is dumb, deaf, or visually impaired, whatever you call it, there will not be any effect on their survival or on their livelihood. But if proprioception and vestibular component is not there in any human being, or if it is not functioning to the optimal levels, that means the total being a human being will not have a meaning to it. Because proprioception and vestibular activity, or the sense, they are precisely to do with all your motor patterns and all to your balancing component of it. So let us think, if a human being cannot move, or even if he moves, that movement doesn't have any meaning. And even if he is moving, there is no coordination. And the effective use of muscles and the joints is not taking place in order to perform an activity, is not happening properly. Then you can understand, right, what can go wrong, right? So any kind of information which you receive through your other senses, whether it is auditory, whether it is vision, whether it is olfactory, gustatory, touch, any information which you receive, you first receive it at the point which we call it as stimulus, right? The stimulus, you receive the stimulus and you process it to the brain, and then brain registers it, and then probably you will be looking in terms of a response. And this response is, most of the times, it is measured with motor movements, or the behavioral component, or the emotional regulation, right? It is measured in those lines. How is your response? Is your response apt with your motor movements? Is your response apt with your emotional regulation? And is your response apt in terms of your behaviors in that particular social situation, right? Now, if proprioception is not in place, or vestibular sense is not in place, that means your response is the one which is affected. So your auditory system might be good, your vision might be good, your olfactory, gustatory, your touch might be good. But if your vestibular and proprioceptive sense are not good, then that means the response which you expect out of the child, or an adult, or an adolescent, is not apt, is not there, is not as expected the way it should be, according to their age group, or when you compare them with other children. That's what the impact of that would be. So finally, if the response is not good, then basically the child is nowhere, right? The child, or the learning, or the constructive learning is not at all taking place in the child. So this is how important a proprioceptive sense and a vestibular sense plays a role. Now, let us go back from the womb. Let us go back when the child is in the womb. Now, the proprioception develops in utero, right? Proprioception develops in the womb. The minute a child hits his hand towards the uterine wall of mother, that gives him a feedback. And that feedback allows them to understand where their body part is touching, and teaches them the movement and their body part. So it starts straight up in the womb. It starts developing in the womb. And when the child comes out of the womb, the first thing, they start the head control, right? They develop the head control. Once they develop the head control, they'll start coming onto their belly. Usually you call it as tummy times, and then they start rolling over, then they creep, then they crawl, then they sit, or then stand with support, and then they walk. So first, what is developing? The development is precisely with the gross motor development, which will help a child to develop their cognitive, their language, and their fine motor skills. Now, what is proprioception? What is proprioception? It precisely tells us about the position of our body parts in relationship with each other, in relationship with others, and in relationship with environment. Right? That is precisely what proprioception is. And the primary function of proprioception is to communicate information about how our body is moving in relationship to us, in relationship with others, and in relationship with environment. And now, if that is lost, just imagine what will happen. So this starts developing, as I said, with every gross motor skill. You name the gross motor skill. With every gross motor skill, the proprioceptive and vestibular capability of the child keeps increasing. Or to give you more precisely, to tell you more precisely, I'm really very sorry if one of the mother can, if they can take their video off, if they can switch off their video, it will be very helpful. It's a bit distracting over here. So the initial way it develops is, first, all of the things are very reflexive, primitive level, right? Primitive level, or primitive level of functioning, or the primitive reflexes is what a child is born with. And this primitive reflexes will help a child to understand how to move their body in relationship with the environment. And slowly, gradually, when the primitive reflexes start getting integrated, the growth of, or the enhancement of, the proprioceptive skills and the meaning what they are making out of moving their own body parts will start becoming established in the child. So primitive reflexes play that particular part of it in helping child to understand where the body part is and which body part is moving. And when the child starts developing the postural reactions, and when the child starts developing a refined motor pattern activity, then they start perceiving the information through their senses, and the output will come in a coordinated way with their body parts. Then the complete task is finished. Now, a simple example. Let's take a simple example. If somebody tells you to pick up a pen, you just immediately pick it up. Now, let's say your auditory system is good and you're able to take the instructions. So you have taken the instruction that pick up a pen. So your auditory sense is good, you have listened, you followed the instruction, then brain has sent a signal to your eye to locate where the pen is. So with your vision, because your vision is good, you are able to locate the pen, and then the outcome is you should pick up the pen, right? You should pick up the pen with your motor pattern, with your movements of your upper extremity. Now let's say if your muscle, or if your ligament, or if your joint is not sending appropriate signals to the brain to precisely move up to that pen and pick it up, child will not be able to perform. And that is what precisely your proprioception does. Your proprioceptors, the cells which are there in proprioception, are embedded in your muscle spindles, they are there in your ligaments, they are there in your joint capsules. So whatever information or whatever movement you are making, a signal straight goes to the brain. A signal straight goes to the brain, allowing you to know how your body part is positioned. And if that signal is not going properly, then the trouble starts, right? Then you can say that the proprioception is not in place. Now, how can we hold? Let's say if I give you two cups of water, one cup of water is in paper glass and another cup of water is in plastic glass. Now, the amount of force which you use, the stabilization what you use, the hold, the grasp strength what you use is all to do with your proprioception. That's why you don't crumble the paper glass in your hand, and the water will not spill away, right? So that is the difference which a proprioception makes, which in other words, how much force our muscle needs to do an action is again the work of proprioceptors. The force, the speed, the direction, the way you are positioned, with another person, all this information is carried through your proprioceptors to your brain. And as I said, this muscle spindle, this Golgi tendon organs, and this joint receptors, whatever we are talking about, they all give you a guidance regarding limb velocity and movement, the load on the limb, and the limb limits. So these are the precise, just give me a second, please. I'm really sorry for that. So precisely, this is the work of your proprioceptors, and the central nervous system. What it does is it integrates this proprioception with other systems. So proprioception becomes very effective in terms of developing the vision and the vestibular sense, and three of them together will allow a child to understand his body position, his movement, and his acceleration. Now, I really don't know whether whenever you got your assessments done or whether anybody has evaluated your child for sensory processing. There is a way we evaluate it. There is a way what we evaluate it is there are two types of proprioception activities which takes place. The first kind of proprioception activity is conscious proprioception is what we say, and the second one is unconscious proprioception. Conscious proprioception and unconscious proprioception. And when you talk about conscious proprioception, it's all about you want to reach there and pick it up. So you are tuning your brain for that kind of activity. Hey, my limb needs to be moving this much to pick it up, and this is the force which I need to apply to lift that particular object. But unconscious proprioception is something which plays a very vital role in human beings, which is more a kind of reflexive too. Why I'm saying reflexive? Because when you walk on an uneven surface, you don't really look at the ground, right? You just keep walking, adjusting, because you're even if your feet are tilted, even if your feet is not going on a smooth surface, your muscles are sending information to the brain to adjust your body accordingly, and you're taking that path without falling down, right? So that is called unconscious proprioception. And these two, the conscious proprioception and unconscious proprioception, works at a different level in the brain. The unconscious proprioception works at a cerebellum, whereas the conscious proprioception works at cerebrum, so which is a higher level of it. So that is how we usually evaluate a child. That's how you need to be looking at a child. How is this conscious proprioception working, and how is this unconscious proprioception working? Now, let's say what happens when a child is on a tummy. How does that develop? How it progresses? You usually keep a child in prone on their tummy, and child starts lifting his neck, and he starts looking around with his neck. So he starts understanding that by moving his head, he is able to look around. Then, child will slowly, what happens from there on, eventually he'll start rolling over into one position. And if something is enticing for him, he'll start approaching that particular object with his arms, which precisely again takes place when you keep a child in a cradle and you tie these auditory stimulating and visual stimulating toys, and child approaches towards it, tries to grab them, So all these things will enable the child to develop this proprioceptive sense right at the age when it should be. So this conscious and unconscious effort of proprioception precisely will develop once the child starts walking. Once child, once child starts walking, then the development of or the enhanced output of proprioceptive skills starts establishing in them. Now everybody perceives information in a different way, so basing on that particular perception of information, can everybody please mute their microphones, please? Thank you so much. So every child perceives information in a different way, and basing on that perception of information, it is classified into two different things which we are very familiar with, that is hyposensitive and hypersensitive, right? Hyposensitive is that especially when you talk about proprioception and hyposensitivity, some children are hyposensitive and need constant input to feel where their body in space is. They want this constant input. That's the reason why they are always on the go, or they're fidgeting when they're sitting in a chair, because they want to feel their body and they want to see how their body is positioned in relationship with space. On contrary to other side of it, it is hypersensitive kids, or proprioception being hypersensitive. Usually these children are the ones who get overwhelmed very easily, and we usually classify again it into four different patterns, right? That is that low registration and seeking, sensitive and avoiding. Usually the major part of it, what have seen most of the therapists or most of the parents talking to me, is on these levels. So what it means to be low registration, it's nothing but, child does not recognize or process all the incoming information, and they do not compensate by trying to gain more sensory input to fulfill their need. Like, there are children who are uninterested, inattentive to the surroundings, not bothered about anything in their surroundings. So those are the children who can be classified at the low registration with proprioception. And when you say about seeking behaviors in the same thing, seeking, the only subtle difference between low registration and seeking is, as I said, in low registration, they do not compensate by trying to gain information to fulfill their need, but in seeking, they try to overcompensate. They try to overcompensate by trying to gain more information so that they can fulfill their need. That's the reason why they become hyperactive, or they're always jumping around, or they're not safe to move around. These are the certain things which come along with seeking. Now, when it comes to sensitive kids, they are usually, they feel overwhelmed very easily. They do not actively try to avoid overstimulation, but they get frustrated. That is the difference between sensitive and avoiding kind of kids. When you talk about sensitive, they feel overwhelmed, but they don't try to avoid overstimulation. But with a bit of extra stimulation going around them, they start displaying frustration, and they are easily distractible, irritable, and they're very cautious kids. All these things play a vital role in terms when you talk about a child with proprioceptive sensitivity concerns. And avoiding, they avoid everything and they are not at all worried. They are very lethargic kids. So these are certain things. Now, when you take these four components and classify them under hyposensitivity and hypersensitivity, the two things which fall under hyposensitivity is, number one, kids with low registration, and number two, kids with sensory seeking proprioceptive category will fall under hyposensitive category. Please take it down, because you get to hear these terms a lot, right? But you need to know what these terms mean for you and for your child, especially when you talk about proprioception. Because as I'm saying, hyposensitive, the classification, if you have to take from these four factors, low registration and sensory seeking kids will go into hyposensitive, and sensitive and avoiding kids will go into hypersensitivity. And what would be certain signs and symptoms which can crop up when you talk about hyposensitive, low registration kids? They'll have difficulty navigating through room. They try avoiding objects. They appear very floppy and have difficulty in balance. Sitting, they cannot sit upright in a chair. They lean against people, or leaning against furniture will be very precisely seen. They will have this W sitting, and children who are having concerns with maintaining a proximity with each other, how far they need to be standing, how close they can be with other person, and all the activities which require balance, they will be having a difficulty with, and they usually stumble and fall more than children of their age. So these will be certain precise characteristics of a hypersensitive child with the low registration. So why I'm giving this is for you to really lay down a sensory diet basing on it, so that you are not mixing everything. Because what I come to see is every time when you talk about proprioceptive and vestibular activities, the immediate things which strikes the mind is slide, swings, trampoline, physio ball. These are the immediate things which come, and everybody will be doing the same thing. But it is different basing on the hyposensitive concerns and hypersensitive concerns. And hyposensitive with low registration, I've given you those signs and symptoms. Precisely look for it, and the program would be different for that. And when you talk about hyposensitive seeking children, these are the children who push and play roughly with other kids, press too hard when they are writing. The nib of the pencil will break, or there will be paper will be torn while they are writing. And they bang. These are the children who have got a lot of behavioral concerns. Please understand that. Hyposensitive, proprioceptive seeking children, the presentation of them will be more towards the behavioral component of it. As I said, like whatever I'm telling you now will seem like a behavioral concern, but actually they are not behaviors. They are because of this proprioceptive seeking hyposensitive sense in them. So as I said, push or play rough, or pressing too hard with the nib of a pencil, or they bang their head, or they keep hitting their body parts, and they prefer wearing tight clothes, and they are constantly in motion. They're constantly in motion, always want to run, always want to jump, and when they walk, they keep stamping the foot. And these are the children where the early indicators for you will be tiptoe walking. Their early indicators would be tiptoe walking. So these are those hyposensitive proprioceptive concerns. And when you talk about hypersensitivity and hypersensitivity proprioceptive concerns together, when you join them, as I said, the two classifications which come under them are sensory sensitivities and avoiding children. So when you talk about sensory sensitivities, it is more to do with lethargic presentation. They are very dull. They hold body in very odd positions, and they become tired very easily. And these are the children who will present to you with the low endurance and low muscle tone. They appear very stiff when they walk, and usually you tend to see a little bit wide-based gait when they are walking, and they will have precise difficulties in developing fine motor skills, like example buttoning, or turning the door knobs, or turning the pages off, or just holding a spoon properly and taking it up to the mouth. And usually the best way to know whether your child is on sensory sensitivity or not, just throw a ball to them, ask them to catch the ball. If they are not able to catch the ball, that means they have not developed coordinated movements, which is a classic presentation of a child with sensory sensitivity towards hypersensitivity with proprioceptive concern. And these children are hypersensitive to pain. Like I've seen some children, complaining, saying that by holding a pencil to write 2 or 3 words, they start complaining, saying that their hand is paining. And whereas in hyposensitivity, those children are very hyposensitive. The highest pain also, they'll just get up. I mean, they might be bleeding, but they just get up and walk away from there. So these are certain things which comes into sensory sensitivity component of it. And when it is about avoiding, wearing wearing tight clothes is something which and refuse to participate that requires more physical effort or more physical exertion, they start avoiding. So these kids are more to do with withdrawal kids, and they will not be participating in social situations. And these children are extremely sensitive to touch also. Well, the proprioceptive children with the avoiding behaviors of proprioception, they will be excessively sensitive to touch also. Now, this is how you actually look at proprioception. What is proprioception, the impact of it, and what is that hyposensitive and hypersensitivity, low registration, avoiding sensitive and seeking behaviors, and how you classify and the set presentation of symptoms, because the way you handle them, the way you have to handle them precisely varies from each classification of it. Now, proprioception, they usually say it is a multifaceted system. Why it is multifaceted system? Because it regulates your behavior and it develops a sensory motor control. I'm making a very big statement here. It regulates a behavior. It regulates behavior and it regulates your sensory motor control, which is the way you respond to interact with anybody or to interact with the environment. So if your behavioral regulation is not in place, and if your sensory motor control is not in place, your output is never going to be to the expected levels. And that can go wrong if your proprioception is not in place. Now, let me just take you a few steps ahead. Now, what will happen? Now, what will happen if you're not really addressing these components? What will happen is very, very serious disorders which they develop when they become adolescents or adults. Why I'm saying is, they will land up in having and taking psychotropic drugs, because if proprioception and vestibular activity is not in place, children slowly tend to go towards or start developing psychiatric disorders. For example, I'll leave you. I'll just take you forward in a sequential way. The first thing, the long-term effects of this would be on your posture. Overall posture, like which we say postural disorders. Postural disorders is if you really look into why posture is important, because it helps us get orientation of our body parts and position of our center of gravity so that we remain in balance. And flexible postural reactions or anticipations for balance recovery after a certain disturbance. If somebody pushes you, if your posture is not maintained, you will fall down, right? You will trip down. But that particular thing, that particular anticipation and the balance recovery will take place properly without falling down if your proprioception is placed. Okay. And then comes, if I have to give you certain examples for if a child develops postural disorder because of proprioceptive concerns, the few things which can go wrong in them is poor aim when they have to reach for an object, or low muscle tone, overall generalized low muscle tone and low endurance levels. And they will be having a chronic tension of muscles in their neck and head and in their shoulders. And they're not at all, they lack this inner motivation. They will not have this inner motivation to do any kind of work, and poor bilateral coordination. And these children, they will never be able to relate their experiences. And usually what we call, most of the parents say that, I don't know, he's 8 years or 9 years old, but still he's having constipation. Still he cannot pass his urine. So we call it as shy bladder. One of the reasons for shy bladder is because their proprioception not being in place. Their proprioception that could be the reason for their constipation. But the minute we see that, we start addressing it in terms of going for the biomedical stuff or going for different diet stuff. I'm not saying all that is wrong, but what I'm trying to say is this particular thing we tend to forget about it, but start looking in that angle also from today onwards. See whether it might be as simple as his proprioceptive sense, which is not syncing with his body, thereby he's developing this shy bowel and bladder. So this is the first thing which can go wrong, that they'll develop this postural disorders. And the second thing which will go wrong is praxia. All we know about it, all of us know about praxia. It's nothing but they will develop poor motor coordination, planning, organizing, and sequencing, which means basically they get lost in their school when they have to perform with their writing skills. They get lost in terms of performing their own activities of daily living, because these all involve sequential steps. These all involve sequential planning. You need to plan, you need to organize, and then you need to sequence your motor patterns, even if you have to put your shed on, right? So all those ADLs are gone, and all the academic skills are affected because your praxia not being in place. So these are one of the two components which can happen from this 4 years to say about 10 or 11 years, say about till that particular point of time. These are the signs and symptoms which you'll start seeing. Then comes when the child starts, once the child develops the secondary sexual characters, and when he's moving towards his adulthood, that's where the problem starts arising. And hope most of you would have heard about schizophrenia. And schizophrenia is one of the things which is closely related with sensory motor regulation, especially the proprioceptive concerns. I'll give you examples as I keep talking. The first thing which comes to my mind at this point of time is self disorders. We call it as self disorders in schizophrenia. Precisely, they say, certain researchers say that there is a very close establishment of proprioceptive sense not being in place. This self disorders will become difficult for the child. Like it evokes incoherent self experiences, including certain terms which we use. Maybe you can write down those terms and have a look at it, or you can correlate your children if your child is an adult. Depersonalization, ambivalence, and diminished sense of agency, and loosening of associations between their thoughts, their feelings, and actions. There is no connect. There is no connect between their thought, their feelings, and their actions, because even if they are having a proper thought, even if they are having a proper feeling, the output which needs to be delivered through their actions, their proprioceptive incapability will not allow them to do that. So there are certain things which we keep hearing, especially I hear certain things like, parent, child, when he's adult, they come and keep saying this particular terms, I think I'm dissolving. They say, I think I'm dissolving completely, which tells us a clear-cut indicator that it is because of his proprioception or bodily disintegration, he starts feeling that, and which is a strongest component of one of the self disorders. And some people come and say that, I know it's my body and face, but it doesn't feel this way. It's scary, and they keep saying that the body does it, but I'm not in it at all. My body does it, but I'm not in it at all. So these are something which we call it as somatic depersonalization disorders, which is because of the proprioceptive incapability. And this proprioceptive incapability will get so strong into their thoughts and into their fields, and nothing will get linked. And they lose their touch among their self-identity, their self-awareness, their body awareness, and in relationship with what is happening in their surroundings. And there is one more precise presentation, which they call it as catatonic disorders. Catatonic disorders, it's nothing but these would be people who flip between hyperactivity and underactivity. There is sometimes they are hyper, sometimes they are under. And there's some terms, probably I'll give you those terms. It's called stupor. It is like there is no motor capability working along with their psychological component. In other words, we call it as psychomotor activity. There is no interaction taking place between that. Because of there is no interaction taking place between that psychomotor abilities, their interaction with the environment is limited. And waxy flexibility, another term, like you take the if we ask a child, can you give me your hand? They'll give the hand like that. And after you shake your hand, the hand remains there. Until and unless you don't tell them to, again, you can take your hand back, the hand will be there like that for hours also. That's called waxy flexibility. And something which we say, posturing. Posturing is nothing but actively holding a posture against gravity. They tend to maintain one posture against gravity for longer duration. And mannerisms, you know that mannerism is nothing but an exaggerated action. And stereotypies is one of the thing which develops very strong in them when they come to that. That stereotypies, we all know, it's nothing but that repetitive movements, and they will be very agitative without any reason, and they will develop echolalia to a very gross level. And another one which they develop is echopraxia, is what we call echopraxia. Echolalia is just repetition of words, right? Echopraxia is nothing but imitation of other person's movement. So these are the things which can go wrong if the child goes towards that catatonic presentation, because if his proprioceptive sense has not emerged or developed the right way it should be during this till that adolescent phase. And the most important, another categorization according to what the Diagnostic Statistic Manual 4, the differential diagnosis, what they bring, differential diagnosis includes bipolar disorders, attention deficit hyperactivity disorders, and oppositional defiant disorders. These are the three categories they say has to be differentially diagnosed in order to take a child and consider a child to be having affect dysregulation. Affect dysregulation, how do you know that a child is having affect dysregulation? Is nothing but they will have explosive rage and anger without any reason. That is called affected dysregulation. A problem with explosive rage and explosive anger where you cannot control it. That particular thing, now clinicians started to consider it is due to the possibility of the proprioceptive feedback. So that is the amount of impact. That is the amount of impact which, if proprioception is not being handled properly, the long-term effects can be there. As I said, that they will develop certain psychotic disorders. They become completely independent in their activities of daily living. They will not have social participation, and they will not have a proper behavioral regulation or affect regulation, and their academic skills by large would be affected. So now imagine these 5 components which I have mentioned, if they are not in place, then what are we looking at? Then what are we working at? So that important it is for you to intervene early with your child if you find them to be having concerns with proprioceptive disorders. Now, how do you know? How do you know that your child is having proprioceptive concerns? Usually, what most of the therapists I have seen, or what most of the parents, the conclusive factors, how they determine whether the child is having proprioceptive disorders or not, is by all those examples which I mentioned, like his inability to sit in a place, or he's having a slouch posture, or he's not able to write properly, or he's having postural disorders, or he's having concerns with his praxia, or he's toe walking, or he's sitting W sitting. These all are examples, but the way you assess them is completely different. So please take a note if you want. We usually see the effect of proprioception and how we classify. We classify to understand a proprioceptive disorder in a child with the 4 factors. We take 4 factors into consideration. And the 4 factors are, the first one is the tone and the joint alignment. How is the muscle tone and how are the joints aligned? And to know them, we assess muscle tone in them, and we look for hypermobility of the joints. Like if your child is standing, how is his knee when he's standing? Is it curved, or is it straight? These are the categories which we look into. So as I said, The first factor is tone and joint alignment, in that we evaluate muscle tone, we evaluate hypermobility of the joints, and how the joint alignment is in itself, and how the muscle co-contraction is taking place. So these are the factors which we look into under the first domain. Under the first domain, in order to evaluate proprioception. And the second categorization is all about behavioral manifestation because of proprioception. And this behavioral manifestation would be the number one, tiptoe walking, pushing objects or pushing others, or enjoyment when while being pulled to a greater extent, and crashing and falling, and overly active or overly passive. These are the behavioral manifestations which we look into it. And then comes your postural motor. Then comes the postural motor, where we usually look into how efficient the ankle is being used in a child, how adequately is he able to weight bear and weight shift, and how is there any decreased postural control, is there any decreased feedback related to motor planning abilities, decreased feedback related to motor planning abilities, and inefficient grading of force, doesn't know how much of force which needs to be applied to do things. These are certain things which we precisely look into when we talk about the postural motor. And then comes the fourth component, which is the motor planning. Motor planning, it's as I mentioned, it is more to do with feed forward. What we say is feed forward. You push the child forward, you will understand whether he is able to stay there, or he's again, this feed forward in relation to motor planning, and whether the child has developed a midline crossing. So these are certain things which we usually look into. But as I said, probably if you can give these four factors to your treating therapist, they should be able to take it forward. The four factors which I'm again stressing out is tone and joint alignment, motor planning, postural motor concerns, and behavioral manifestations of the same. Okay, so you ask them to evaluate them to see these four factors, then you will be able to establish and understand whether your child is fitting towards hyposensitive kid or hypersensitive kid. And even if he is hyposensitive kid, whether he is developing or he is prone to develop the low registration symptoms or the seeking symptoms. That's how you classify it. That's how you determine that your child is having concerns with proprioception. Your child is going to develop whatever the long-term effects I've told, is going to develop all that if you don't address your child in this fashion. So I don't know. There are a lot of kind of therapies on this. Maybe the therapeutic body wraps, TBW, what they say, right? Therapeutic body wraps or compression therapy. And I think the one therapy which made a huge noise around a decade back is this packing therapy, which is precisely they have used it for children with autism. In French people have used it. But there was a lot of controversy, and then it developed and evolved from there and kept moving forward. So there are a lot of programs, there are a lot of therapeutical models which will be given based upon the classified four factors and where your kid is falling into it, towards hyposensitive or hypersensitive. And if he is hyposensitive, whether it is towards low registration or sensitive, that particular classification, basing on that, this therapy models have established. So Saujanya, I think I'm done for it. So I'm ready to take questions if you have any.
So much, sir. It's very valuable. Let's see. Some of them have typed the questions here. It's from Satya. My kid is 5 years old. Can we have combination of hypo and hyper, as the child is constantly jumping, but his tactile issues as well, stiff body, etc. Also, can vision processing affect proprioception?
100% yes, because as I said, proprioception is something which goes hand in hand with vision and vestibular system. They integrate together to get an elicited coordinated body movement.
Thank you, sir. If anyone else has a question, we can probably address 5 of them. You can ask.
Yeah, thank you.
And
Thank you.
sir,
Sir, so vision therapy. So Satya here for the same question regarding the vision. So vision therapy also can be given separately along with the proprioceptive activities, sir.
I really don't understand the logic behind vision therapy being separate, auditory therapy being separate, or proprioceptive being separate. What you need to understand is all the senses need to integrate together to do a multisensory task. Unless and until your multisensory system is not functioning effectively, your output of or your the work. The response from the child will not be the way it should be. So I really, I'm not a person who looks into each sense by its own component and working on it separately. That will definitely not help. It should be worked in closure. I mean, in sync with each other.
Okay, sir. Okay, got you. Sir.
Question,
sir,
please.
Good evening.
sir, my
This is
son
Sabimunisa.
5 years, sir. Sir, when my son falls down, he shows that it is paining and all. But once the wound dries up, he pulls off even if it is getting blood also. Why is that so, sir?
That is a typical presentation of tactile concerns, ma'am. So you need to be looking it more towards the tactile concerns than from the proprioceptive end.
Okay, okay, sir.
Sir, good evening. One question from my end. My son is 23 years old now, identified as LD, but he has loads of anxiety. But it has come down, a long way. We have gone through a big journey. So, but when he was young, he had this hyposensitivity towards pain, and he used to bleed. He had a deep cut, and he was, happily walking with the flowing blood and all. Right now, being an adult now, he has still problems with registration. He can't take up the registration, multiple commands and all. So we have to be very clear in our instructions. But being an adult and, to survive in this world, I really face this problem with him. So could you please help out if I can help him out in this regard? Thank you.
See, there is this classical, what do you say, misperception or myth, thinking that sensory integration or whatever we do, the sensory integration program is only up to a set point of time or up to a set age. That is something, a very big wrong notion, which is there among therapists or which is there by large in the population. No, what you require to do with him is get back to your basics, make his sensory system or sensory processing, make that foundation more strong in him for him to respond the way you are expecting out of him. So as long as you don't get his sensory processing in place, he's all lost. He's not perceiving information the way you are expecting him to perceive, right? So the basic thing is not there in place. And we are expecting these children to perform at a cognitive level. So let's say if you are talking about a level of 2 or 3, that is not there in place, but we are expecting them at level 8. And that increases the anxiety more in them. That makes them to become more oppositional or more defiant towards things. And the environment becomes more frustrating and intolerable for the person with him and for the child himself too.
Right. But my son was a classical LD, sir. Like his IQ is 90 and he has no ASD, other things at all. But I faced this problem since childhood, and I myself is a special educator, so I have guided him throughout. Now he's in MBA final year. He is performing well. but I am there to support him and he needs me. But see, end of the day, I will not be there with him everywhere, right? So here again, that issue, that problem is there still. So if I can get back to the sensory integration, is that okay?
You have to get back to sensory integration and start working on developing a proper motor pattern activities for him.
Oh, great.
Proper motor pattern activities for him, that will take him to the next level.
Oh, thank you so much, sir.
You're welcome.
Right, sir. We'll
Hi,
wind
this is
it off
Samraj.
with 3 more questions.
Yeah.
Let me read them out to you. So this question is from Radhika. Where can we get them assessed and find therapy in Bangalore? Any leads about that? So especially ODD is not diagnosed here.
Yeah, unfortunately, many of the people really doesn't address the component or really take into consideration, or they don't even know what ODD is and how a child with a sensory processing disorder slowly will go towards ODD. Also, that they are not, many of them really doesn't have that. But what you need to understand here is that simple logic. This has to be done by an occupational therapist. Assessment has to be done by an occupational therapist, and if they are certified in sensory integration processing, then it's more benefit because they will go up to this levels of determining the factors first and then providing the sensory data. Otherwise, it's like, as I said, like every center will have a trampoline, every center will have a slide, and a child will be keeping on jumping on it, and they say that that will reduce their hyperactivity. That those things can be eliminated. So what you need to be looking at it is the person who is really experienced in this field to do this job.
Yeah, thank you, sir. So the next question would be from Deepa. Her kid is 4 years old and he falls in hypersensitive seeking behavior. What therapy can help him? Is OT enough?
Yeah,
I see.
see,
Yeah.
definitely OT is the one who should be helping you with it. But again, I'm a person who would like to work with a physiotherapist too in this concern, because physiotherapists play a vital role along with occupational therapists to develop the proprioceptive and vestibular component in a child. But the understanding, if it comes to India, the understanding is that physiotherapists don't have any role with autism, which is again,
Right. Yeah.
a very bad way of looking at it, because a physiotherapist will be more helpful in developing the proprioception along with the sensory integration therapist. If they both can join hands together and work with the child will be able to really get through it.
Okay. I'll
Thank you,
just
sir. Thank
see
you
if
so
I
much.
can find something. Thank you. Thank you.
So how
Mr.
do we
Gentleman?
improve sound and vision together?
No, that will take it on the next level
Yes,
because
sir.
I think we are talking about proprioception.
Yes. Is there any checklist available over internet where we can determine whether the kid lies in hyper or hypo category?
If they open looking for a checklist in Google, they will find maybe around 2 lakhs of pages on checklists. But by doing it, it's definitely not going to help them. It might help them to understand that there is a problem, but how to fix the problem, where exactly the problem is, they require a professional help, Saujanya.
Thank you, sir. The last question would be from Premalata Bhagat. Based on your answers to parents' concerns, understood that sensory can work out at any age. Correct me if I am wrong. What early intervention helps then, sir? Please elaborate.
See, sensory integration works at any time. Take it for granted. There is no second thoughts about it. Number one. Number two, coming to the point of what early intervention. Early intervention, the course itself has established because of the reason that we have varied modalities like speech separate, like psychology separate, like OT separate, and physio separate. But what an early intervention does it is bits and pieces of all these courses together, so that they can see the child as a holistic and start addressing things in a holistic way. So that's what the early intervention is. So there is it is what early intervention is required is not the question. Early intervention is required, and there are people who are graduated in early intervention who learn bits and pieces of every component of this and start working with the child when the child is very young. Did I clarify that, Saujanya?
It's clear, sir.
So, and the last question is, are there any exercises for proprioceptive behaviors?
Oh, yes, it's all, it has to be dealt with motor patterns. It has to be dealt with exercises.
So where can they find it? That's the question from the parent.
Saujanya, see, we can create an awareness and tell them that the problem can be here and it could be because of that. So once after we give the talk, the onus is back on parents to see whether the child is having any of those concerns or not. If they feel the child is having those concerns, we are trying to educate them in terms of what exactly their questions should be and what they need to be asking a therapist when they go to the therapist. But end of the day, once they learn this from us, once a therapist evaluates them, parent is clear, therapist is clear on how to take the child forward. But the program has to be created by the therapist, Saujanya, end of the day.
Yes,
because as I said, it is child specific. As I said, like if you go to any center, most of the centers are filled with trampoline, and I see child immaterial of whatever proprioceptive capabilities, they keep jumping on the trampoline.
So it's very important that they do in collaboration with their therapist.
100% yes, they have to collaborate with their therapist, but make sure that if you feel your therapist is not up to that level of things, see, because there are new graduates, there will be experienced people. You cannot expect a new graduate to know what 20-30 years of experience person can give you. So even then, in certain places, you might not have a facility to up to that level. So what we are doing here is we are trying to educate them in terms of making them self-capable to understand their own child and to know what needs to be done. But if I start giving exercises now, I see there are more than 50-60 parents over here. So if I start telling you the exercises and the treatment modalities, 60% of 60 of the parents, most of them might think this is what it needs to be done. But when it comes to creating a program, it's child specific.
So in this particular response, one parent says, "Can I arrange an OT room? It's expensive, but can I arrange an OT room and ask OT to come and help my child at home?"
100% yes, why not? 100% yes, why not? But OT room being expensive, I'm hearing for the first time.
Arranging at home, sir.
Arranging at home itself.
Yeah.
Arranging at home itself, OT room establishment should not be 8,000 to 9,000 bucks.
Yes, sir. Thank you. Thank you so much. It's really very important to understand where our webinars are coming from, what they can expect from them, and how they can use this knowledge to work with their therapist. So thank you, sir. Thank you so much. A couple of parents still have a question, but I think we will address them in the next session because we are running out of time here.
Yes. Thank you so
sir,
much, Sautanya. Thank you all the parents.
Thank you, sir. Thank you so much. It's really very important to understand what proprioceptive is. Generally, parents use this word a lot, but today we have got a clear understanding of how it works in a child. So I hope this session is very helpful. Thank you, sir. Thank you so much
Saujanya.
for your valuable time. Thank you. See you soon.
Yeah, bye-bye.
Thank you.